I'm Tatiana Rondek, Director of the Evelyn F. McKnight Brain Institute at the University of Miami, one of the only 4 institutes in the country funded by the gift from McKnight Brain Research Foundation. We are dedicated to uniting a diverse teams of scientists and clinicians to drive a cutting-edge research on age-related memory loss and cognitive impairment. We hope you'll find these talks informative and inspiring.
Hello, everyone. It's my pleasure to be here to give a lecture to discuss about the aging, how can we aging well. So my talk is particularly focused on the music and aging well. This is the outline of my talk. So I will give introduction of a relationship between music and the brain function. Then we're going to discuss some beneficial effect of music on the brain aging. Then I will discuss the research project we are doing in the University of Miami. And last one, I will give some future direction about what I think about future music and cognition. So what can we do in the future? All right, so first let's start to talking about what's the effect of music on human being. So music is very powerful agent. So effect of music, the first of all, have some physiological functions. So in the multiple systems, such as cardiovascular function, so can regulate heart rate and blood pressure, right? So if you have a classical music, you tend to lower heart rate, lower blood pressure, so you can relax. So sometimes you have like a pop rock music, you can actually increase heart rate, become very excited. So next is music actually regulate respiratory patterns. So if you have like, especially you can see in the people do the yoga, so they put the music is very quiet, calm music, make people have a deep breath. So that's all the music effect. Then we see the hormonal regulation increase. Relaxed music can decrease cortisol level, help to reduce the stress. And also music can stimulate neurotransmitter release like dopamine in endorphins. So those is make people feel pleasant, feel rewarding, feel better. So last one is music also can regulate muscle skeleton function, reduce muscle tension. So mostly I want to talk about music is a powerful agent to have an effect on the brain function. So from this picture, this is the image we call PET scan. So you look at the brain activity. So one on the left side without music, then right side you have a music. You can see the brain, this red color, it means the brain light up. So that's activated by the music, listen to music. So that's why number one, music actually enhance cognitive function. Then can regulate emotion, so people can feel happier, but also can feel sad, depending on what kind of music you are listening. Then the music also has been seen can increase brain connectivity. So brain have all this we call snaps, connect each other, form kind of like network. So there's a connectivity, so can increase connectivity. So lastly, so music actually can improve the sleep. So those we all know, when you cannot sleep well, you had to put sometimes very calm music help you fall asleep. Also can actually help regulate some motor skills as well. So multiple functions. So how the music works to the human brain. So human brain, there's a emotion physiological response to music are mediated called the limbic structure. So this is on this picture shows the limbic structure. So have a multiple component brain region. So this is the limbic structure subsequently communicate with large cortical network, then have develop different function. So mostly music, we are interested in the music and the memory. So Yeah, so we know that music have been shown very, very strong affect memory. So especially in the impaired situation is amazing. So like there's some case report, so professional pianist diagnosed with a severe dementia, but even so dementia so severe he probably cannot recognize other people, but are still able to play familiar music. The next example, like a waiting list with moderate Alzheimer's disease, although he has very severe marked deficit in recall and recognition people, but still can learn some music. So 80 with a severe memory and cognitive impairment, although unable to respond and sing familiar sounds, like in nursing home, you see the people with the severe advanced Alzheimer's disease, they still respond to the melody. So that's how can you see the music is a very strong agent, also can preserve a lot of region, preserve music memory. So that's why music has been, some people say, as a memory enhancer, right? So especially memory are pure for life. When you grow up, you have some love relationship with the family, and leisure and work time, stress relief. So those all connect memory. So one of categories of memory, so they call the music evoked autobiographic memory. So this memory actually is considered, when you listen to music, you know this for a long time ago, associate the place, time of your life, then you can record some memory at that time. Studies show that listen to music, this familiar music can result in the evocation of autobiographic memory. So study also show that autobiographic memory was a significant better when exposed to some emotional events, either sad or happiness. So they tend to be remember vivid. Also, is usually as a very intense, connected with the emotion. So how about music for the cognitive aging, for the normal aging process? If the music can do something, we know the music actually done a lot for the children development. So that's why, music school is very popular for the early childhood music study. So a lot of parents bring their kids to the music school to learn the rhythm, to expose the music, because that helps the brain develop motor skill, develop all the learning skill. For the aging population, what do we have seen? So what we see is listen to music, especially familiar, emotional, significant sounds, can improve memory retrieval in patients with Alzheimer's disease. And dementia studies show that autobiographic memory was significantly better when exposure to some sad music. Also, elderly with normal cognition can engage music, playing an instrument or singer, shows a better episodic memory and verbal record than non-musicians. So this is a part of the study, of course, probably have a lot of adjustment to see what exactly compare musician, but in general, there's evidence show that. Also, old adults with music training, even if they stop playing years ago, has a strong cognitive ability, include better executive function and working memory. So then, listen to music, particular upbeat, rhythmically engaged tunes, improve cognitive processing speed and mental flexibility in the old adult. So those all effect for the normal aging process, because those is the normal aging process. We know some cognitive function have some decline. So let's review the cognitive spectrum of aging brain. So what kind of cognitive spectrum we are talking about? number one, we're talking about a normal cognitive aging. So those people is completely normal, then, but have some decline. The second stage we call mild cognitive impairment. So third stage we talk the dementia. So this is a lot of patients ask me that in the clinic, what's the definition? What do you call this? So we can go one by one. So normal aging. So as we say, so once you are 70, 80, your memory is not as good as 40, say 20, so 50 even. So, but even that, but this will not affect your daily life. So you forget things minor here and there, but your life move on. You engage in social activity. You still to learning. You still manage your finance, all those things. So this is normal aging process. Then next stage, so this is more obvious some decline. So this decline is not just only experienced by yourself, by other people. They think you are not as good at function as before. Also, this is persistent everyday things. They can really observe this is something clear decline. So this is, but you're still independent. So this is called a mild cognitive impairment. This is a second stage. Third stage is called dementia. So dementia actually is just general term, is a very broad syndrome. So its basic means you cannot live independently because you're so forgetful. So it tell you things like 5 minutes ago, you will be repeat ask about 5, 6 times, right? So that is not functioning for your daily life because you pay all the bills, so you're driving, you always get lost. So that's we say this is function level interfering in your daily activities. We call that the dementia. Dementia, like Alzheimer's disease, is the most common cause of dementia. So right now, we have at least 10 million people affected with a mild cognitive impairment. So like in 5 years, it's predicted, anticipated 1/3 of those people will develop Alzheimer's disease. So this is really very big social issue. So that's why when we look at all the research, look at all the social status for the aging population. So as a cognitive neurologist, we always think what else we can do, what kind of research we can do. Then things we already learned, music have so much good impact on the brain function. So why, if we can do some research to understand music and cognition. So that's where we started in the University of Miami, Miller School of Medicine. So also this study actually, we have a joint collaborative work with University of Miami Frost School of Music. So first things we want to say how the music work with the brain. So how is the music to bring connectivity, we think is very important target because this is a way to tell you how the brain works, brain activity. So how is it connected with music? So that's where we start. So this is showed like our recruitment brochure. So we recruit people 60 to 85 years old age without cognitive impairment, but also still able to walk around, have not professional musician, have at least less than 5 year formal musical training. So in this situation can speak English, then we recruit for this study. So our aim, so number one is explore the nature of a cognitive emotion response of music-evoked autobiographic memory in old adult with or without cognitive impairment. So aim two, we investigate the brain connectivity of music-evoked autobiographic memory as compared to non-autobiographic music So we hypothesize brain activity will be more widespread for the music-evoked autobiographic memory when listening to the music that has been familiar to the person, compared to music with no personal association. So that's our second goal. So this picture shows the procedure, step by step, how we do the research, right? So first of all, we recruit the participant research. Then we have iPad, we have questionnaire. So we collect information, demographic information also about understand how much music background, how is the music listening, what's the background of the list music he provide, right? So we have someone interview research subjects. Then we have a clinical assessment. So I'm the one doing the clinical assessment. So after we finish all of this, so we have a compiled list for music for the individual. Then we use the brain MRI scan to collect information on function MRI. So in that way, we can look at the brain activities by the network connectivities, right? So that's how we proceed the music study for this research. So this is phase one, basically the neuronal network connectivity autobiograph music in adult with or without Alzheimer's disease. So at the current time, we recruit, original plan is a 15 participants with mild cognitive impairment or Alzheimer's disease, mild. And for 5 cognitive normal control. But now we recruit already 21, I think, participants with MCI and cognitive normal person about 25, 24. So this is some graph show the response to the autobiographic music. So we can see that mostly about 78% of this participant response to select the music period, elicit memory of this period, mostly is adulthood. The music they associate is adulthood, then adolescence and young adulthood, but less common with childhood, right? So similar is most people, the event is adulthood event. So we have questionnaire to figure out what's the response. People mostly they feel they have a strong emotion when they listen to the music. Also at the time they feel this emotion is very pleasant. I think we are particularly collect mostly as a pleasant music. Then we look at the neural connectivity. This is the resting stage. So it has described on the literature. So many areas on the resting state have a brain activity. We have live parahippocampus, gyrus, basic ganglion, and cerebellum, also prefrontal lobe. So it's basically verifies. Confirmation is previous study also is we see the same thing. We have resting state activity connectivity in the adult aging elderly. Then we look at the neural connectivity. So from neural connectivity, it's interesting. We see that great signal difference in the right parahippocampal cortex for the familiar music versus unfamiliar music, listening condition, control for age and brain volume in the normal cognitive elderly. So summary, so what we talk about today, mostly music has a beneficial effect on the cognitive aging. So even you don't have, you listen to music, not necessarily you have to be patient. Even normal aging process, I recommend you can start regularly to listen music. That help stimulate your brain, increase your brain connectivity. So second, So our ongoing study has shown that great signal difference in the brain region involved in the memory formation for the familiar versus unfamiliar listening condition, even control for age and brain volume. So next, so what's a future study? So right now we are continue analyze data, so about compare the people with a mild cognitive impairment and the normal aging group. So what's the difference? Brain network activation. What's the difference of brain connectivity? Then what else we can do in the future? Can we use established protocol to treat the patient? So close this talk, I'd like to echo the Dr. Lee Pierce quotation. What he said, what good is all the medical science in the world in extending life if it is not accompanied by an acceptable quality of life for a broad number of people and nations? So our research is response to this quote is dedicated to improve the quality of life powered by music, either in the aging population, also we try to help treat the people with the disease. I want to show my acknowledgements. So we are grateful Dr. Lee Peace Foundation, which strongly support our program, so we are able to move this far. So next is I would like to thank my co-PI, Dr. Teresa Lasky. She is a professor at University of Miami Frost School of Medicine. She is the main PI investigator to drive this project move forward. Thank you very much.
Thank you for watching. Thank you to all the participants who have come to our lectures. Thank you to our partners. And most of all, thank you to our sponsors. See you next time. Keep aging like a pro.